First, I want to say thanks for joining us tonight. I'm Michael Wilson in for Darren and Erica this evening. The Arkansas Department of Health reports another 15 flu deaths this week and says we are seeing a very high level of flu-like illnesses. 5 News reporter Catherine Gilker is in the newsroom with why ADH says we are seeing so many flu cases. Catherine.
More than 14,000 flu cases have been reported to the Department of Health since October, and 45 people have died from the virus, including 1 child. ADH says 73% of people who have died did not get the flu vaccine.
We're having, a severe flu season, and we're near the, at the height of that right now, this year. Hopefully that flu season will start to go down at some point soon.
ADH says 749 patients have been hospitalized for flu in Arkansas since October, with people 65 and older hospitalized more than any other age group. Even so, more than a dozen children under the age of 4 have been admitted since October. Dr. Joel Tomlinson, the state's medical director for immunizations, is keeping an eye on those numbers and the rising number of flu deaths.
It's unusual that we have 45 deaths at this point in the flu season, because usually the flu season starts later, right? Usually we would just now be seeing the rise in flu cases, or maybe not even until January. It depends on the year.
Tomlinson says it's too soon to know how effective the flu vaccine is this year, but he still encourages anyone to get it if they haven't already. After a slow start, he says the number of people getting vaccinated continues to rise during a period when it usually drops off.
And I think that's due to the early start to the flu season. People took notice. They knew lots of people around them were getting sick with the flu.
Baptist Health Fort Smith is caring for 23 flu patients, with 7 of those in the ICU. Between their 2 ERs, Baptist has seen 20 flu-positive patients since Tuesday. Dr. Upton Siddon says about half of the patients he's seeing each day come in with flu-like symptoms. He says the near constant changes in weather could also play a part in flu circulating.
You're more susceptible to get ill when you're cold and you're tired and you're hungry. That's one of the reasons this is cold and flu season. It's because overall population health is kind of at its lowest point during late fall to early springtime.
Also says that at the beginning of flu season, there were more cases in children, but that has now shifted to adults. They report the average school absentee rate last week was just 7.5%. Catherine Gilker, 5 News.